October is Breast Cancer Awareness Month, and we know that prevention and early detection is the key to beating the disease. So today we asked Dr. Jenny Wilkins from Age Vital Pharmacy how to be proactive in our breast health. All right, again, prevention is very important, and part of that is early detection. Tell me how people start to get into the habit of, looking and making sure they're healthy.
Well, number one, it's not just for women, because 13% of the breast cancer cases now are males, and that's just unheard of. Like, what is in our environment? What's causing, men to actually get breast cancer? So one has to wake up and go, what am I drinking? What am I eating? What am I around? I just spent, the whole entire, 3 days, this past 3 days, the Cancer Cures, big international conference just on cancer in general. So cancer is cancer. So it's not just, it's people,
it's not just breast,
not just breast. It's all, the root cause is all still the same. But start, for women, it's like check yourself on a daily basis, looking, doing the test, the breast test, and for guys too, because then you're looking for lumps, you're looking for, discharge, you're looking for tenderness and lymph nodes.
But how important is it to, early detection? Like, is it curable once you get to stage 1, but if you get to a stage 4, does it make a difference?
I have fantastic news. It's curable at any stage because it is all environmentally related. And one of the big eye-openers for me was, how cancer and mold, fungus, have the same similarities. And now they're linking mold, fungus in our environment. And then you're thinking of all the corn with all the mold and fungus. You're thinking of everything that's processed, that grows, fungus, mold, the mildew. And and when I'm doing those live blood cell analysis in-house at the pharmacy, I'm thinking, why does everybody have so much fungus in their blood cells with bacteria? So what's happening is the fungus and the bacteria are fighting because that's impossible for both of them to go together. So once you have bacteria and mold together, that is
it creates a problem in your body.
Well, tell me about abnormalities. So
tell me about the symptoms that people can, when you start about breast cancer. What are some of the symptoms and signs that we need to be aware of?
Well, some of the most common symptoms are the lump in the breast. Someone's like, oh my gosh, what's going on over here? I know I felt it at one time or another. Discharge. I was just speaking to a young lady this morning. She says, I'm having purple discharge coming out of my nipples. I'm going, well, that's not normal. You need to go get yourself tested. Let's look at, different markers, protein markers. G protein, a big, huge marker for breast cancer. Change in shape. It starts, drooping, or it looks a little bit sideways. It just doesn't look like a normal breast anymore. And the change in texture. So you're starting to lose a lot of, the texture. It almost feels fibrous. So you feel multiple, almost like a little tissue, like grainy.
And that's why a self-assessment is so important, because you'll notice changes, right?
Yeah, and that's better actually than the mammogram, because you can detect that and
definitely early stages of it before you even get into the doctor's office. Well, tell me about some things you could do as far as supplements and things to make sure your body is healthy and you're getting all the right nutrients.
One of the things I recommend now, because fasting is so important, anybody that has, that has bad habits, it's recommended, to fast for 2 to 3 days, nothing but water, just alkalining it with minerals.
Flushing your system.
Flushing your system, had a big 67% decrease in cancerous type cells, damaged cells in the body. So that's huge. I think people should fast for at least 2 days out of the month, just, in general. But increase of selenium, vitamin D, antioxidants. So you're talking everything that protects mitochondrial function, just increasing. I've seen stage 4 cancer without radiation, without chemo, 100% eradicated.
Wow.
Just by doing what the body needs, getting to the root cause of the disease, and not just, going in there with an A-bomb and, depleting your immune system.
All right. Well, thank you so much, Dr. Jenny. And of course, if you want to get some tips on how to keep yourself healthy and early prevention, you want to go to Dr. Jenny's website, agevital.com, or just visit her in downtown Sarasota off Main. And next, we're going to get spooky. We're going to be making some pumpkins. We'll be right back.